Hello to all of my Support Fibro friends out there. I'm Melissa from the Support Fibromyalgia Network. I just completed a podcast interview with Amanda, so shout out to her. And one of the conversations we were having was all about advocacy. So it got me so pumped up that I just wanted to jump on here and share with you and really send a message to invite everyone in to join us in 2021 for our advocacy and public awareness events. It's going to be good. I know. And it's a good reminder too that in 2020, we still did the advocacy stuff. We launched our first ever Fibromyalgia Advocacy Day in Capitol Hill in 2019 in September. And from there, we went on straight and we came in March of 2020. We were in Capitol Hill, and I'm so grateful to the advocates that joined us. It was kind of stressful. We didn't understand this pandemic. We didn't know what was going on. So it was everywhere on the news. We didn't know each day if we're going to make it to the end, because we flew in a little bit early and we had to go to our meetings on Wednesday and Thursday. So are our meetings going to get canceled? Was this a wasted trip? But we learned a lot from it and we continue to persevere. So our dedication, definitely, please let your people know we are extremely dedicated to fibromyalgia here, because Wednesday we showed up and we had our meetings. We took some extra meetings and there were a ton of people at Capitol Hill. It was packed. But then Thursday we were doing a big chunk of our meetings as well. So we got there, and funny story, I pressured everyone to get there early because I'm not an early bird, but I definitely like to be on time, and I'm generally more on time than usual. I get there early. So everybody was a little bit like, why are we getting there so early? But I wanted us to be like almost the first in line through security, because security takes a lot of time. I was going to have us like maybe eat some breakfast while we were there. So fortunately, we got there early. We had some time to like get some breakfast and stuff and fuel coffee, but then like not shortly after did they shut down Capitol Hill on us. So no one else was allowed in the building, but we were already in. So our community advocates did an amazing job. We took our meetings, and thankfully a lot of our representatives still had the meetings. We had a few cancellations, which wasn't a big issue, but the meetings were amazing. People took so much more time with us than we had ever had before in September. And it was great. We had group meetings together. We still talked about fibromyalgia. They remembered us from September and they said, keep going. A lot of the offices said this is going to take a lot of groundwork. You're going to have to keep doing it. You're going to have to keep following up, keep getting people involved. So that's what we're going to do in 2021. We're continuing the advocacy fight. We want you to get more involved. So if you're interested in being a part of advocacy and public awareness, let's do it. Join us. It's a huge community effort. We have the voices. We have millions of us that need to come together. We need to unite, and we need to take action to move this forward, because we do need more funding for fibromyalgia research. I can't emphasize enough. This is decreasing. Our research for fibromyalgia specifically is decreasing in funding. They're trying to get it from other realms, but we need to fight for specific fibromyalgia research. And this is important because of the changes that are happening across the country with our providers. So we're hearing more and more that people are getting turned away from rheumatology departments because they no longer treat fibromyalgia. So who do you go to, and what's the training involved? And in order to get a standard medical education care model going, you need evidence-based research. So you need the research, and in order to educate the providers. So this is also filling in a huge gap. So that's where we need the advocates to come in, because we need to push. We need to push on all levels, our community levels, with our mayors, city councils, Congress, and senators. So everybody together, there's a lot of work to be done and a lot of shared work to be done. So we have to come together, and this is super important. I'm excited because the work that we're going to do, we're going to go hard. Starting in February, launching the Fibromyalgia Impact Tour, which was supposed to be in person. So we're going to address quality of life, start to begin our own research funnel. So we're going to do a lot of research on quality of life food insecurity, what do you have access to? So we need your help with that, filling out the surveys, because that's going to be our own research from our organization point of view. But then, it's going to go straight into advocacy and public awareness events, training for proclamations. I would love to have that widespread proclamations everywhere, fibromyalgia proclamations everywhere. Shout out to our good friends at Looms for Lupus who've been so supportive of us. Juana did an amazing job helping us with proclamations, did it for lupus, fibromyalgia, and mental health. So we are joining together with some amazing community leaders to get this done. They're doing a lot of mentoring, which I think is fantastic. If anyone out there feels like, I want to get it done, but I don't know what to do, this is the perfect place for it, because I'm big in mentoring. I've struggled my whole life to find different types of mentors or anything. I never was successful, but working together with these community leaders has been game-changing environment for fibromyalgia. So we're going to continue down that path. We've been talking to the amazing and brilliant Crystal Kent from the Fibromyalgia Pain Chronicles and Veteran Voices for Fibromyalgia. I'm excited to work with her more. So this is going to be a great year of us actually coming together, unified, and taking action. The big thing is taking action. I know I say public awareness, but we also, besides educating the public more and more, we need to take action to do the advocacy type of things that need to get done in order to move the needle for more federal funding. I congratulate all our lupus friends out there. They've done an amazing job. If you've seen the press release going out there, they got extra funding for lupus research. What an incredible advocacy effort they've done for years, many, many years. They kept pushing and pushing, and they've accomplished a tremendous amount of funding, even with this year and how it's gone. So I congratulate all our lupus friends out there, and thank you for helping us in the fibromyalgia community follow through on doing the same thing for fibromyalgia. So we need to get it done, folks. We have to take action. We need your voice. We need you involved. So again, those proclamations training, I don't mind having video calls if you're interested and want to learn. This is a learning process, and I don't want people to feel like they're on their own trying to figure this out. So we're going to be doing that with proclamations. We're going to be having more patient education type of things with our community leaders, patient education conferences, virtual Capitol Hill Day. Let's get it done with that. Let's invite people virtually from your home. You can talk to your representatives. We want more people involved. Eventually, we'll get back to Capitol Hill, and you'll see those memories. We're going to share it in March as we throw back to our March days. We had new advocates come in and new family. It's a family affair. We had, people from all ages join us. We want to increase that. This is a great opportunity virtually to do that. And I'm excited to involve more people this way, because I know it's difficult to travel to Washington, D.C. to find the funding and to figure out, what we were doing. We're all crammed into hotel rooms together, but we make the best of it. So virtual is a good way to go, and it's a good way to start, and you can get more in contact with your representatives, and you can share with them about fibromyalgia, your experience, and the importance that they need to know, the important points and the important talking points of what our community needs from them. We are looking for other state leaders. So if you're looking to eventually become the state leader fibromyalgia representation, so you can provide training to other people in your state regarding fibromyalgia advocacy, that's going to be a big deal. So we're looking for people who are really interested in doing more advocacy work. And again, this isn't something that we want you won't have to figure this out on your own. That's what we had to do recently with the launch of Fibromyalgia Advocacy Day. I had never gone to Capitol Hill before. I'm so grateful for Estella, Juana, Cassidy, and Isabella. They came in, they told us how it was done, and Crystal has been an amazing voice as well. She's teaching us about advocacy and the work she's done with the veterans community. Congratulations to Brian Talley and the Talley bill and everyone who actually worked on getting that Talley bill passed. Incredible. I can't wait to learn more from him and how he got it done. That was perseverance, and we need to persevere in the fibromyalgia community and push hard. I see Suzanne, count me in. Suzanne was incredible at advocacy with all the stuff that was going on. And I can't downplay how intense it was, and not knowing what was happening. Because again, we were at the hotel and we were seeing like bus loads of tourists coming in. But at the same time, everywhere, every day on the news, they're talking about the pandemic. And we weren't sure what was going to happen next. Were we going to get stuck in DC? Because there was talk that they were just going to stop travel. So we learned as our fibro bodies tried to calm ourselves down as much as possible. So thank you to Suzanne for making the trips a couple of times and managing with all that was happening. So I appreciate all our help, and we look forward to continuing this. And again, it's going to be virtual. So I invite everyone to join us with this, and this is a great opportunity to continue advocacy for fibromyalgia. Even virtually, we can still make an incredible difference for the community. And we're going to lead that in because the research, push for research, gets more medical education. And then we have the funnel. We're building the first ever echo for fibromyalgia, and I will do a separate video again to go through what that means. It's all telementoring, not telehealth, telementoring for our medical providers. So we're going to build a community system for our providers to feel welcome and get the up-to-date education so that they can translate that into every community actually around the world. This can be an international effort. So I've been talking to our international advocates and sharing with them about the ECHO model because it's important that we do this internationally, have consistent information, and have doctors from around the world talking to each other. We're going to integrate mental health professionals, health coaches, art therapy groups, and also support groups. If you've been running a support group for a while and want to get involved with the ECHO model, we need funnels for providers to send patients to get the support that they need. I'm excited about the art therapy groups. So there is a lot going on for 2021 that I am pumped up about, but after doing the podcast interview, I wanted to make sure to relay that advocacy is alive and well for fibromyalgia. We are taking a lot of action. It's not going to stop, and we want to increase public awareness. And when we talk about public awareness, we're doing fibromyalgia education to the public, but we're also taking action. So we've done a lot of awareness, and I know Brandy from Being Fibromom mentions this a lot. She has some fantastic blog posts about this, how it is time to take action. We have done awareness, done what we can, but it feels we need to take action to fulfill what we need to accomplish for fibromyalgia. We need to increase funding specifically for fibromyalgia. Start funding more research projects. I love the work that Dr. Younger is doing. I've seen some other research happening. I've been networking with more researchers. They are fascinated by the brain avenue and what more we can do and quality of life. They want to help us. So we need to just connect the dots together and bring everyone in. So that's what I'm excited to do. Please reach out, send us a message if you're interested. We have stuff on the website to connect, or send me an email at melissa@supportfibro.org if you're interested in joining us for advocacy. You'll see it on our page, our pages and information, and you'll have more ways to sign up and get involved. But if you know right now that you are thrilled and want to do more in your community for advocacy, reach out. I know it's the holidays, but I still work during the holidays because I am pumped up about this. And this is my bucket list for me, is getting fibromyalgia to where it needs to be. It's been a long, hard road in my personal health journey. I don't want people to experience what I experienced. So we are making the necessary changes that need to get done. I'm passionate about this. I'm not going to stop. So holidays don't stop me. We just keep moving forward. So if you're interested in getting involved, I would love to hear from you. Stay tuned. Thank you. I will jump on for a special holiday message. But I definitely, if you don't get a chance to see that, happy holidays to everyone. Stay tuned for a lot coming in 2021. And please tell your friends about our organization, share our content, like our page, get involved. We need you. We need voices for fibromyalgia. Thank you again. I'm Melissa Toller from the Support Fibromyalgia Network, and I will talk to you soon. Bye.